Now it's my pleasure to introduce Jeff Roe. He's President and CEO of Premera Blue Cross, the largest health plan in the Pacific Northwest, serving 2 million members in Washington State and Alaska. And Jeff is leading the transformation of Premera to a consumer-centric company. And as you'll hear, he has a unique perspective working with large, innovative West Coast employers that you know their names, Amazon, Starbucks, and Microsoft, to name a couple, who have transformed the customer experience. And so he's bringing this consumer-obsessed culture to healthcare to make it easier for Premera's members to understand their healthcare benefits and navigate their healthcare options. And Jeff actually began his career here on Capitol Hill in the office of Senator Slade Gorton from Washington State. So we're delighted to be welcoming him back to the Hill today. Jeff?
Good afternoon. Thank you. It's great to be here with you and to be a part of this important discussion. This is really an esteemed panel. I'm honored to be a part of it. So you've heard a lot about healthcare policy today, and I think the insights that Governor Leavitt, Bob, and JD have provided thus far have been really excellent. As we move this discussion forward, though, I'm going to move in a slightly different direction, and that is to step way outside of the box of policy and examine the issues from a fresh and totally different perspective. As Nancy just said, I spent 4 years on Capitol Hill, and I found one of the great values that I benefited from was when an outsider came in and actually shared a perspective from a place other than Washington, some that might call the real world. So I'd like to talk about 3 Seattle-based companies that are well known throughout the world for the tremendous success they've achieved in 3 very different industries. Success that's been driven by technological innovation, by operational excellence, and perhaps most importantly by providing a great customer experience. And they are, as Nancy said, Amazon, Starbucks, and Microsoft. I'd assert that there's a lot that we can learn about the potential future of healthcare from these companies. And all 3, by the way, are clients of Premera Blue Cross. So join me for just a few minutes as we consider these questions. What if Amazon, Starbucks, and Microsoft ran healthcare? What kind of system would they create? So let's start with Amazon, the first of these. We have served as Amazon's health plan since 2012, so we feel we know them fairly well. Amazon, first of all, is obsessed with its customers. They have worked relentlessly to put the power back into the hands of consumers. They are an organization that makes decisions based on actual data, not pithy anecdotes, but hard statistical evidence. And they combine these 2 great obsessions, customers and data, to deliver an unequaled customer experience, one that makes every interaction with their customers simple and easy, fast and integrated. So at Amazon, as you know, you can buy just about anything in the world in an environment that is all about transparency. Amazon customers are given information they need to compare products by cost, by quality, and by user reviews, thereby helping the consumer to make purchases that's right for them. You can get really low prices at Amazon, but you can also pay more for products that provide superior quality and value. The choice is yours. And they do all this without requiring their consumers to do much more than to simply access the internet. The product does the work, not the consumer. So this dynamic makes Amazon suppliers compete and compete aggressively. Bob brought this point up as it relates to healthcare. So let's contrast this level of transparency, which is so fundamental to a well-functioning marketplace, with what consumers are subjected to in healthcare. Prices are completely opaque. The consumer leaves a provider and later opens an envelope with an explanation of benefit in it after the fact of what the service cost. As one person remarked at Premera, there's a surprise in every envelope. Reports on the quality of care are highly complex and confusing. Providers compete mainly on the basis of their brand name and the convenience of their location, not on service excellence, and certainly not on the quality of their outcomes. That lack of transparency permits dramatic variation in cost and quality in the delivery of health care. something that a well-functioning marketplace would never tolerate. In Washington State, we have providers who charge 30% more than the market average, even for basic routine services with quality that is just average, if that. It's simply not justified, and yet provider reimbursement rates often are presented as a take-it-or-leave-it proposition, particularly in those concentrated markets Bob highlighted. So in essence, you pay more and you get less. In any other industry, consumers would never tolerate such treatment. So a competitive and transparent marketplace wouldn't sustain such significant differences in prices for any services. Another thing about Amazon, a customer phone call there is considered a defect. Think about that for a moment. If a customer feels the need to call Amazon to discuss an issue, Amazon considers that a defect because Amazon has failed to provide a process that is seamless and simple enough for the customer to not need additional assistance. And yet, if a so-called defect occurs, Amazon is available immediately to help the customer get the issue resolved. So in contrast, at health plans today, phone calls, including my health plan, by the way, phone calls are the primary way consumers get questions answered. Amazon's so-called defect is our primary mode of interaction. And as an industry, we still use paper, forms, prescriptions, and so forth. So let me say that again. It's 2016. I think this is important, and we still use paper and fax machines in healthcare. It's unbelievable. If Amazon ran healthcare, I believe we'd see an integrated marketplace platform that would seamlessly and easily connect patients with the right providers, giving patients the objective cost and quality information they need to make an informed decision about the care they deserve. So I ask, is this all a bit just too conceptual for today's discussion? And I don't think it is. And I say that because at Premera, we've already started this process of trying to behave like an Amazon. So let me give you a few examples of how this kind of thinking is transforming our approach to healthcare right now, today. So as we all know, navigating healthcare is too darn difficult. It's complex, it's confusing, it's burdensome. In response, at Premera, we've developed an innovative new tool called Decoder Ring. Decoder Ring, like Amazon's Echo, which you see here on the screen, simplifies the process immensely. With this new technology, our customers can use their mobile device or the Amazon Echo to ask questions like, is my knee surgery covered? What will it cost? And immediately, they get an answer. No more phone calls or trying to wade through a dense, virtually unreadable benefits booklet that has been the norm in our industry for decades. The other thing about Amazon is they're really customer obsessed. It's amazing to walk through their ecosystem. You can feel that pulsing through the environment. We in healthcare need to adopt that customer obsession. I went in for a procedure not long ago, pulled into the facility's garage, and encountered a sign reading, "First 2 floors reserved for doctors." That's not patient-centric. And by the way, that's not unique to that facility. So at Premera, again, we've launched another service called Premera Listens. In fact, it was developed by a former Amazon employee who now works with us. Premera Listens allows us to quickly make improvements to our service based on real-time online feedback collected from our consumers. And perhaps the best part of the entire project is it went from concept to launch in 4 months, which at Amazon is normal, but in healthcare is light speed. So as we look ahead at Premera, we're designing products, networks, provider compensation models, analytical tools, transparency capabilities, and so forth, all with the intent of creating a more competitive environment where providers actually have to earn consumers' business. If Amazon ran healthcare, I believe that's what they'd do, and that's what we're trying to do at Premera. Let's turn to Starbucks for a moment. They've been a Premera client since 2009. So here's a company that sells a commodity at almost twice what others charge. We all are subject to that. So how do they do that? So, as most would say, they sell an experience, not just coffee, right? They offer a familiar place, a warm, inviting environment, an atmosphere where there's likely an emotional connection, and a quality product made to your exact preferences. At Starbucks, I've spent a lot of time down at their headquarters, they talk about the third place their stores provide. There's work, there's home, and there's Starbucks. And people pay a premium for that experience. It's what's behind the experience, though, that most impresses me about Starbucks: operational excellence. They've made a science out of running their stores with an extremely high level of efficiency. Yet, because of their emphasis on the customer experience, you rarely hear the company discuss operational metrics. Contrast that with most health plans. So again, Premera is in that group. We focus on metrics like average speed of answer or claims turnaround times. You'll probably never hear Starbucks talking about grinding beans in 30 seconds or less. And yet we hang our hat on that every day. Yet without this foundation of operational excellence, Starbucks could not produce such a predictable, high quality, and yet personalized experience. You can get your cup of coffee at any Starbucks, anywhere in the world, and the experience will be exactly the same every time and in every location. The only thing that may differ is the languages spoken. Now let's compare that to healthcare. When healthcare works, when lives are saved and well-being enhanced, the experience can be nothing short of amazing. But too often it's just okay at best or maddening and frustrating at worst. A major driver behind these dichotomous experiences is the major lack of standardization. The variation in care patients receive is tremendous. Take cancer care, for example. It isn't unusual for cancer patients to seek a second opinion. And most of the time, they'll get exactly that, another completely different opinion. This will often occur even with two doctors in the same institution. For a health condition rife with such emotional and physical burdens, patients should not have to struggle with the confusion that leaves them wondering if they're truly getting the best therapy for their problem. So as part of the future we envision at Premera, we're working with the Seattle Cancer Care Alliance, comprised of Seattle Children's, the University of Washington, and Fred Hutchinson Cancer Research Center. They're international leaders in cancer care, and we're working to ensure that our members get consistently the best care recommendations for their particular form of cancer from a team of true experts. And along the way, we're partnering with those institutions to provide Premera members with an advocate who will ensure that all of the patient's care needs are met in a way that suits them. That way, they and their families can worry less about the process and focus more on themselves and their own well-being. Standardized, yet personalized healthcare, Starbucks style, we would contend. Another area in which Starbucks excels is convenience. They have more than 24,000 stores worldwide. Starbucks is practically everywhere. In a sense, they bring the Starbucks experience to you. If Starbucks ran healthcare, I'm certain they'd make healthcare more personal and convenient as well. The act of providing care to patients would be the same no matter where the location, but the experience would be tailored to each individual's patient's needs. That's what we're starting to do at Premera. For our members with the greatest need, the 5% of our members who account for 50% of the cost, JD highlighted that in his remarks, we partner with a special team of providers who bring services directly to those patients in their homes and on a schedule tailored to their needs. Doctors, nurses, behavioral health specialists, all of them are ready 24 hours a day to help our sickest members get exactly the care they need when they need it. That's what convenience means in healthcare. And what that convenience translates into is a better experience for the patient that also happens to provide higher quality care at a total lower cost. So I hope from there you could see it's easy to imagine a future where patients visit a brick-and-mortar hospital only for trauma or for surgeries, while all other care is conducted in the home, online, or at convenient neighborhood locations. So finally, my third company to profile here is Microsoft, a company that Premera has been privileged to serve for more than a decade. Not only do we provide their health coverage, but we actually maintain an office on their campus where their headquarters is located in Redmond, Washington. So we're literally a part of their unique and very powerful culture. So I think Governor Leavitt had a quote from Bill Gates. I'd like to share one as well. When I think of Microsoft, I think of empowerment. So over 40 years ago, in 1975, Bill Gates famously said his goal was to put a computer on every desk and in everyone's home. In achieving that goal, Microsoft-powered computers have made consumers and businesses vastly more productive and efficient. In my view, healthcare needs a Microsoft-like movement right now, particularly in developing tools that enable better decision-making and better delivery of care. In healthcare, we're buried in data, yet in many cases, doctors lack the information necessary to empower them to clearly understand their patients' needs. So we're not Microsoft at Premera, but we've built a pretty sophisticated tool to integrate and analyze a patient's information to dramatically improve the care they receive. It's called OneView, and it aggregates all of a member's claims and medical information from the EMR, reviews it for consistency, and analyzes any gaps in care that may exist, like prescribing irregularities. It then presents that critical, objectively analyzed information digitally at the point of care, that is, to the doctor in the exam room. This powerful interpretive tool eliminates the potential problems that can arise when a patient's care is fragmented among a variety of providers. And it gives each of them a complete view of that patient's history. In the process, it thus empowers to provide the best possible care possible, driven by the power of technology. So in conclusion, I'd say this. Amazon obviously doesn't run healthcare and probably doesn't want to. Starbucks and Microsoft probably feel the same way. But the fact is, healthcare needs these awesome companies and needs the same kind of transformation that they brought to other industries. I think as you're hearing today, and hopefully have from me as well about Premera, many Blue Cross Blue Shield plans are working to make that happen. Thanks very much for your time.